Hello, I'm gonna do my IV test out. So I've gathered my supplies and looked over my MAR. So I first noticed that James Wilson has an allergy to NSAIDs, and I looked over the MAR. None of the medications that we're giving him are NSAIDs, so there won't be any interactions. There won't be any interactions with any of the other meds. I've already done my first check of the meds, making sure that there's no expiration, or none of it's expired or can cause an interaction. Okay, so now I'm going to draw up my meds. I've washed my hands. I also have an order to perform an IV. So, should grab a garbage for the beginning. Okay, thank you. Alright, down here. Thank you. So, first I'm going to draw up the hydromorphone. We need, let's see, 1 milliliter of that. Yeah. Perfect. So I drip 1 milliliter of that. I'm going to make sure to label that right away. So, the name, the date, 1 milligram per 1 milliliter, the time, I think it said 08, okay, pretend it's just 8 o'clock, and my initials. I also forgot to mention that I went over the 6 rights of the patient, or, yeah. So I have the right patient, the right medication, the right route, the right dose. Let's see, patient, medication, route, dose, date, documentation, time. Okay, yeah. So I have my hydromorphone labeled in there. I'm just gonna set that right there. And now we need to do the saline. So, I'm gonna grab one of these caps. Oh wait, forgot to grab a needle. Get that in here. There we go. All right, let's try that again. So since I touched everything, we'll just do more hand hygiene. Okay, so I'm gonna just put all my saline in one syringe to save on supplies. So I'll do 5 milliliters, also wiping off the top. Perfect. Draw my air in. Perfect. Let's see. Now we'll label this with the saline flush. Thank you. I would put the needle in the sharp spin. Oh, got that closed. Okay. Okay, so I almost forgot to put a saline cap on the hydromorphone. If I can get this open, that would be nice. Okay, we're good. So, and put that back in there. All right, so now I have my, oh, that's just one that I didn't use. And now I have my medications here. So I can go get the pump ready. Okay, so I'm gonna wash my hands. Let me take out the primary tubing first. Here we go. That isn't all knotted up. We're good. Make sure not to touch either of the ends. James, you really do. Oh, okay, we're good. Bubbles. Oops. Okay, so now take this off, fill up my Minnesota, which I did, and flip that. There are no bubbles in my primary tubing. So I'll make sure that there aren't any in this one as well. Oh geez, that is moved up. Couple little bubbles here. So I don't remember if I mentioned, once I was drawing up my medications, that's when I would do my second safety check, or second med check. Kink in the tube from when it was in the packaging. tired. Okay, whew, got that done. So now, there's some at the end of the primary tubing, or primary tubing. Making sure not to touch the end of the primary tubing, keeping that sterile as well. There, so we can start on the IV piggyback. Here's my secondary tubing. Ooh, forgot that was in there. Okay, so first things first, I'm gonna put my roller clamp down so the medication doesn't go everywhere. There we go. Take the cassette. Just gonna clamp this just in case. Take this off. This off as well. Set those down there. Perfect. Okay. So now, turn this on. Let me check my MAR again. Let's see. Oh, I forgot to unclamp that. Back 9. I forgot to put this clamp on as well. Let's try this again. Alright, so while I do that, I'll put the date and the time. Label both of my primary and secondary tubing. Okay. I probably should label which is which. Secondary. Alright. Now, so for A, my primary, excuse me. So the rate is 100 milliliters per hour. Then we're going to go down to the volume to be infused is 500. Perfect. You can go to program options and put that in standby. And we'll go to B. Oopsies. Okay, put that in concurrent. So, for levofloxacin, according to the drug book, it needs to be at 50 milliliters an hour. Volume to be infused is 50 milliliters, so it'll take an hour. Program options, go to standby. Okay, so now we're ready to go into the patient's room. Which I'll do my third med check, gather my supplies one last time. So I got the saline flush and the hydromorphone. Extension sets, IV start kit, my gloves, my pencil, catheters, IV needles, that's important. Okay. So then I got my MAR and also tape. Okay, so now I'm ready to go into my room. I'll open the door. Hello, my name is Chelsea Wrighton and I will be your nurse today. I'm trying to figure out where to put this. I'll set that right here for now. Can I have you verify your name and date of birth? And then they'd say their name and date of birth. Wonderful. So today we are going to I have an ordered start an IV for you. Also, can I ask you, do you have any allergies? He'll say to NSAIDs. All right, sounds good. So we will get that IV started for you. So we'll go over to this arm. Okay. All right, James, have you had an IV done before? If they say yes, we'll be like, all right. But if they say no, then I'll explain to them the procedure and what it is. Also, James, I have some medicine for you. So hooked up to the IV, there is the levofloxacin. Also, I'd be doing my third med check as this goes on. So that's just an antibiotic that will help get rid of any infections. Then we also have the sodium chloride, which is the other big bag there, and that will just keep your fluid balance even. And then we will also be giving you hydromorphone, and I noticed that you said that you were in pain, and then I'd ask him how much pain he is in right now, and then have him assess that on a scale of 1 to 10. If it's greater than a 4, I believe it said, then I would go ahead and administer that. All right, so now I'm looking at the arm to make sure that there's no redness, tenderness, wounds, anything like that, which it looks good. All right, James, do you mind if we use your left hand? No? Okay, cool. I should have gotten the garbage over now. Okay. So before, I would make sure that there's a garbage nearby. Okay. I didn't touch the garbage, so my hands are still clean. So I put the tourniquet on, and I'm gonna find the vein about 4 to 6 inches below where I put the tourniquet on. So I found the vein, and now I'm gonna sterilize the skin in circular motion. Now I'm going to take off my gloves, take off the tourniquet. I'll also make sure this isn't clamped. Okay. Wash my hands. All right, James. So now, put the tourniquet, my gloves back on. Then I'm going to prime my extension tubing once I get these on. Okay. So I have my extension tubing right here. I will take my saline, and since it is sterile, I don't need to wipe off the port. Alright, I'm just going to prime my extension tubing until it is full, making sure that the clamp isn't on. Whoops. Alright, we are good with that. There we go. Alright, so we're going to take off, or put the tourniquet back on one more time. Alright, James, now I'm going to stick the catheter needle in you, so you'll just feel a slight poke really quick. Find the vein one more time. Oh, make sure that this is loose. Alright, James, you're going to feel a slight poke. Ready? Oops, bevel up. Alright, ready? 3, 2, 1. I see some blood return. Alright. And, okay, great. I actually wasn't in the vein. Let me try that one more time. Sorry, James. Okay. Alright, are you doing okay, James? So yes, or however he's doing. Alright, found the vein. So now I'm gonna feel one more slight poke. Ready? 3, 2, 1. See some blood return, so I'm gonna drop the angle. Take the needle out, and I realize, okay, I'm not in the, oh shoot, I guess I was in the vein. I pulled it out. Let me try that one more time. Okay, and this is where I would have had 3 needles. Whoops. All right, James. Sorry, just one more time. We'll just find the vein. You'll feel a slight poke. Ready? 3, 2, 1. See some blood return, so I'm going to drop the angle and put the catheter in. Alright, so now take off the tourniquet and then take the bandage . Okay. Shoot, it looks like I'm not in the vein anymore. Oh. Okay. Okay, I wouldn't do this in real life. So I'm just gonna move on over to the actual mannequin. Okay, so it was in the vein, but, that scared me. What am I saying? Was in the vein, but then it was too far out, so I'm just gonna continue on. So I'll bring over my MAR. Okay, so alcohol wipes. Okay, so first I'm going to administer the saline, the rest of the saline. So the tubing is primed, although that might not be completely necessary because it's still technically sterile. Okay, so we'll put the saline flush in. We'll put 2.5 milliliters in. Since it's a 5 milliliter, and I'm just using 1 for that. Alright, so we'll take another alcohol wipe. Wipe off the port. I would have my garbage over here also. That's the saline. Okay, so now I'll take the hydromorphone. And this is the medication for your pain, James. So hopefully this will help relieve that. I'll push it in over 2 to 3 minutes. But yeah. So got that in, and I will do one more alcohol swab. Put that in the garbage, but for now right there. And then do the rest of my saline flush. Do the rest of that at also a rate of 2 to 3 minutes. Same one as the medicine. Okay, so now it looks like we are ready to hook it up to the IV pump. Also, I almost forgot to tape it, so I'd probably tape it before hooking it up. Where did my tape go? Here it is. Okay, so using the mannequin, we have the, which I'm not sure if I was supposed to do that on the arm, but we'll just kind of pretend that it's on the mannequin right now. That drops, we'll hook it back up to here. Okay, so as if the needle were in right here, put that onto the skin, probably over center a little bit more, and take off the paper. Okay, so now I'm going to do my initials, time, and the date. And the gauge. And I'll do the time. Okay, so put that on the tegaderm as well. So then, take my tape, sticking to my gloves. Okay, so as if that's where the needle would, just realize it's clamp this on. So do the chevron method like that, or this would be the clear cap over the blue part. Do another one like that. Obviously this would be more linear. And then do one more just to hold it on. And loop it around like this. All right, James, you still doing okay? I would say yes. Good. Okay. So now that I got that all taped, now I can hook up the primary, or the tubing to this. And I would take my alcohol swab. Wipe off the port. Take this off. If I can, there we go. Get up to the patient. And then hit start all. So then it would start, but I'm just gonna stop it for now so I don't put it all into the patient. So I'm stopping all. Okay, so with that still running, then I would go ahead and check in on my patient one more time to see how he's doing with the procedure, see if he tolerated it well. Then I'd go on to document saying the time, date, the gauge that I used, the medications that were used, the location of the IV, and then how many attempts it took, as well as the location, and then to see how he tolerated it. So now I'll go ahead and document on my MAR. And here it is. Okay. Obviously these would all be in the trash that was right next to me. So then I document and we are done.